So I'm going to talk about the Braden scale. This is a scale that's utilized to assess how at risk the patient is for getting a bed sore or a pressure ulcer. The 6 things that's assessed in the Braden scale is the sensory perception, skin moisture, activity, mobility, friction and shearing, and the nutritional status of the patient. There are 6 stages of the that six. There are 6 stages that you use to stage a wound. The first one is stage 1. It's mild. It's non-blanchable. It may be like tender. The skin is intact and is localized. The second stage is partial thickness. There is some loss of the dermis. There will be a shallow open ulcer present. There may be like a reddish or like a pink bed of the wound. You should not see any slough in this stage, but as you move on to stage 3, there's full thickness loss of the skin. You will see a loss of subcutaneous fat. You will see a loss, there may be some slough present there. You may see some undermining and some tunneling, and the eschar, you may see some of that as well. It's like dark black, leathery, kind of tough appearance, and the slough is just like a yellowish kind of necrotic look. Stage 4 is the full thick tissue loss. You will see some tendon loss, some bone. You may see exposed bone, subcutaneous fat loss. You will also see slough and eschar present there. There will be undermining and tunneling as well. Then there are those wounds that are unstageable. So a lot of times you have to clean those wounds out to kind of try to accurately stage them. It'll have the full thickness tissue loss. The depth is unknown, so that's why it has to be debrided or cleaned out to accurately get a stage for it. A suspected deep tissue injury is kind of dark, like a purplish maroon color. The area is localized and it may have a blood-filled blister. In a lot of these wounds, you do have to have some debridement done to kind of allow for healing and to allow for the wound to start closing. And you may also need a wound vac, depending on the severity of the wound, in order to facilitate the healing and also expedite the healing as well. That's it.